Hi, everyone. Thanks for tuning in tonight. Switch gears a little bit away from orthopedics and talk about some of the newer services we're offering here at Michigan Center of Regenerative Medicine. We have Ashley Leone with our regenerative skincare and hair products. She's our resident expert in the field, and I want to just do a few minutes of introducing and give you a little background as to why include these services, why add them to Michigan Center for Regenerative Medicine's list of treatments. And that basically comes down to the quality of the regenerative injections that we can offer here for orthopedics. The outcomes we get are based on collagen formation in tendons, ligaments, joints, and that same process inside your body that helps with pain procedures or pain situations coming from joints can also help with cosmetic and hair services. So hair being a substance also made of collagen, and skin, the largest organ in our body, also being heavily made of collagen, responds very similarly to how knees, hips, spines respond to PRP procedures. So with that in mind, we have recruited, we've incorporated. Ashley's been with us now over a year, and we'd like her to just give a little bit about her background before we jump into the exact sort of treatments we offer. So Ashley, if you could, introduce yourself.
Hi, I'm Ashley Long. So I've been a nurse practitioner for many years. Starting off in the rehab setting, so joint replacements, things that we're all familiar with. Transitions to med surg, then to ICU, and then ultimately back to the regenerative aspect of it in the PM&R world with Dr. Farhat. So I have been a part of the regenerative world for about 6 or 7 years now. Same thing, joints, as he said, spine thing, but also the whole time I was doing this, I also had my own aesthetic business on the side where I was doing cosmetic injecting with fillers, Botox, medical grade chemical peels, all of those things. So it kind of was the perfect storm. And my two worlds collided because our cosmetic industry is moving into the regenerative in such a fast paced and powerful way. And so I'm super excited. And so I got to create my own space here. And it's been going very well. And we're having great results with everything that we're doing.
Yeah, so we've incorporated PRP for hair about a year and a half ago. And for the same reasons I outlined earlier, and the results we saw were really staggering and incredible. Really opened our eyes to how big of the opportunity we had to help a lot of people with hair restoration. So I think we might want to start there tonight.
Yeah.
It's what we've been doing the longest now. Our outcomes have been extremely favorable. And I think it starts with the same mindset we have when we're addressing orthopedic concerns. Starts with a great consult. So maybe walk me through if I'm coming here, and for what it's worth, next week is my first appointment for a hair consult. So I will be a first patient here for me. So walk me through. What can I expect in my
and we do like a lot of physicians, and so you know that it's working, because if the physicians weren't doing it themselves, then that's just a big, huge sign. So the first thing is we're going to make sure that you're the correct candidate. So we're going to look at your hair loss. We're going to look at the thinning. We're going to see the pattern, and does it male pattern baldness? Have you been to the primary care physician? Have you had the labs drawn? We want to make sure it's not a hormone imbalance, things like that. So if we deem you to be a good candidate, then we kind of give you an education on what the process is. So it's a very natural and safe way to restore your hair. You know, if you've watched any of his he's explained therapy in depth many times, so you don't really have much adverse reactions because it's your own blood. So we explain that. And usually it requires, depending on how bad the hair loss is or the thinning, and we do men and women. then we can determine how many treatments we think that you'll need. And usually the typical person, I would say, is about 3 treatments right off the bat. And these treatments, we want spaced 4 to 6 weeks apart. And then after we get you to where your goal is, then they go into the maintenance part of it.
So if you think about, a lot of people are familiar with hair removal services. So you can't go in and have your hair lasered off once and it's gone and it stays gone. And the reason is you got to catch that hair in the active follicular phase. And the reverse is true when we're trying to regenerate hair and we're trying to stimulate hair growth out of that hair follicle. You also need to catch it in its active follicular phase. So
Right.
Unlike orthopedics, where we can stimulate collagen formation in a ligament, a tendon, or with cartilage with one procedure typically, hair almost always requires multiple.
Correct, and that's because of the phases it goes through. So even in the beginning, we might be waking up a dormant follicle, and so it's going to start slow, and we're going to give it that nutrition of that PRP the next time after it just woke up, and it's just going. The process continues to go in the whole phase of the hair cycle.
And there's a lot of adjunctive therapies as well that work quite well. Again, correlative to the orthopedic world, where we'll use different types of treatments to improve the regeneration that PRP is able to stimulate. Things like peptide therapies, topical treatments, energy treatments, red light therapy. Maybe comment a little bit on that.
Yeah, so we also offer, red light therapy here to add on to this service. We also will make a whole treatment plan. So it's not just come and get your procedure and leave. We kind of want to give you all of the tools. So we may talk about topical peptides and things that we want you to put on your hair in that 4 to 6 weeks while you're waiting to come in for your next cycle.
One of the things that PRP doesn't do is resurrect dead hair follicles. If you have lost your hair, you may need a hair transplant. That may be the best way to get hair follicles to repopulate that area of your scalp.
Absolutely.
But PRP can work extremely well after that hair transplant to stimulate those transplanted hair follicles to sprout and grow.
Yeah.
And we see quite a few
We see quite a bit of hair transplant patients who they usually have their hair transplant, and the surgeon who does the transplant usually does one PRP at the surgery. And then he or she then tells the patient that they should come to us, which we have a good reputation with the hair transplant surgeons locally, and they'll come in and get their maintenance of PRP every so often to keep that follicle alive, stimulate healthy nutrition going.
The blood flow, getting the blood flow, all those things are involved. The same reason that PRP works when your platelets in general work when you cut your skin. It stimulates a blood flow reaction that has a regenerative cascade of events that stimulates your cut to heal. In the orthopedic world, your tendon to heal. In the hair PRP world, your follicles to sprout new and stronger, thicker, denser hair follicles. So.
And we do have a lot of patients that come back and they do say like the texture of their hair is thicker. Their hairdresser is telling them that it feels way different than the time before, and the hairdressers are asking for our cards and our brochures because they have all these patients that they want to refer.
So what started for us as kind of a side interest has now become a major focus. So we are very, very excited. A space dedicated strictly to delivering these services, a provider with the correct background, the correct passion, and the correct skill to deliver those services. And I think there's going to be a very good service line for both our patients as well as our business. So kind of switching gears, very, very similar in the idea that hair follicles are made of collagen. Our skin is also a collagen based organ, and treating things like fine lines, wrinkles, skin pigmentation defects. If you could maybe elaborate a little bit on the indications to maybe have your skin evaluated.
Yeah, so when people come in for their skin evaluation for microneedling, or a lot of people know it as the vampire facial. So same process, it's the PRP. We take your blood, we spin it down in a centrifuge. We have a state-of-the-art lab here, which not a lot of places do have. So in my opinion, we have the best PRP and the highest quality PRP. Um, and we can help things with fine lines, acne scars. That's one of the biggest things. I can have anybody in my care, an 18-year-old that has struggling with acne scars, all the way to somebody who, in the elderly ages trying to stimulate some collagen. So it's not gender specific, men and women. And we're helping with pigmentation, their pore size, their sun damage, or fine lines and wrinkles, as you said.
Yep. So sun damage and
Uh-huh.
fine lines and wrinkles in my elderly face is something we're going to be looking to fix. So you'll see a before and after on our webinars.
Yes, for sure.
Very similarly with hair, there's a lot of adjunctive therapies that can help the skin regenerate as well. We have a lot of that available here as well.
Yes, we definitely do. So we have some prescription strength, which I forgot to mention with the hair, that we've personally, Dr. Nabby and I have sat down, got the data, the scientific research to see which peptides are good for hair and which are good for skin, and we've formulated our own compounded prescription that you can only get through us. It's not on the shelf. These are things that we have researched and put together, the ingredients to give our patients. And I feel like that's one of the reasons why we have such good outcomes.
Yeah,
for sure.
Leveraging our relationships with the compounding pharmacies to help with formulations that would make sense to be used in a topical application for face and hair. And it's preliminarily looking extremely promising on some of the great outcomes we're getting.
Yeah. And I'd like to just touch on the downtime with the procedure as well. With hair, there's really not much of a downtime. You go back to work that same day. There might be a little bit of tenderness at the injection sites, but we do offer Pronox, which for a lot of people, they know it as laughing gas, complimentary while you're undergoing the procedure. With the facial microneedling, we do numb the face, so that's more comfortable. In the face, you might have redness for a day or two. The skin may feel tight on day 3 or 4. There may be a little bit of dryness or flakiness as we're stimulating those cells to turn over pretty quick. So that's why you experience that initially. However, going forward, the PRP is going to help give you a better retention of moisture in your skin long term. So that's one of the benefits as well. So very little downtime for both of these procedures.
And it's not just the topical applications or the microneedling applications of PRP. Sometimes it's not just tightening of the skin we need, but we're losing volume as we age. Marionette lines commonly develop as we get older, and filler has been a mainstay for managing those sort of conditions. But rather than injecting a foreign substance in your body, and there's an alternative that can actually stimulate growth of collagen to give you that filler look through more of a natural process. That's another indication and training that Ashley is very skilled at providing.
Yes, so I did train with the Cellular Medicine Association, Charles Reynolds, and he is the founder of the Vampire Facial, and there's also the Vampire Facelift. So that's more precise. You can lay down filler, or you can lay down straight PRP plus the microneedling on top of it. So, filler has its place, as we said before, Botox has its place, just for any of the neurotoxins. They're all great. What you really want is a comprehensive treatment plan to make all of these go together for you in the most natural and safe way.
Coming to a place where if you have knee pain, I can talk to you and do a consult about, you know, everything that's available in the treatment option. You know, whether it's blocking the pain and a pain management type of mindset and pain management pathway, or whether it's trying to regenerate the tissue that's causing the pain and putting your regenerative thought process in place. It's very, very similar to what we're doing here now with our face and hair treatments, and that we can offer everything from the traditional cosmetic services, the fillers, the Botox. They have their place, they have their indications, and then the regenerative options that also have their place and have their indications, and potentially can give a longer lasting and more natural result.
Mhm. Yes, and we also we offer Sculptra here as well. And I don't know if you guys know what that is, but it's also a biostimulator. It's FDA approved, so you can complement your treatments with that as well. It's a poly-L-lactic acid injectable, and pretty much, in a nutshell, it's actually what suture material is made of. So that suture material, when you're having surgery, is meant to produce collagen to heal you. So it's the same kind of concept that we can inject into the face in the same manner that we could PRP as well. And maybe if you're not a great candidate for PRP, maybe you don't feel like you have enough good PRP in your own blood, you might be a little bit older, or maybe a lot of comorbidities, we can use the Sculptra in that case.
All comes with that whole step one of getting a good outcome is a good comprehensive consult. Taking every patient as a unique individual, taking all the co-founding variables into play, and then using our skill and our knowledge to come up with what we believe to be the best treatment plan for you to get the outcome you're looking for. Kind of maybe a little bit of a foreshadowing of what's going to happen. We don't have a live demo to do tonight, but we are planning a grand open house event sometime in this summer, and we will definitely be having some live demos for that. So please stay tuned for an announcement on the date and the time for that event. There'll be some, of course, fun giveaways as well. But if it's something you're interested in learning about before maybe signing up for a consult with Ashley, that would be a great event to attend and see what the procedure looks like, what the outcomes potentially can look like.
Yes.
So we want to keep our webinars as comprehensive and informative, but also not belaboring points. So I think with that, we will turn over to some questions. Thank you to those who have turned in, and we got a couple questions to ask. So we got one here from Ron. Is hair localized to promote growth only on a part like the head? So no, hair follicles are hair follicles. As long as you still have the remaining hair follicles, we could stimulate growth other locations as well. But the top of the head is the one that most people request. And then Karen, do you have an online gallery showing before and after results? No, we don't. That would be a great thing to add.
Yeah, we actually have a book here for anybody that comes into the consult. I do go through the book with them and show them many different types of hair loss and what our outcomes were. Our book really shows our outcomes specifically, which I love. It's not just something before and after that we found on the internet. These are our patients that we know. A lot of the reasons why you can't do it before and after is because people have to consent. So some people are okay with us showing on social media, and some people are only okay with us putting them in the book, and only like if somebody comes in for a consult. And then there's other people, you do not have to consent at all. They don't want their pictures anywhere, and they just go right in their chart and never to be seen again. So your secret's safe with us if you want to keep it that way.
Yeah, we're very sensitive to patient confidentiality.
Mm-hmm.
And then one more question about 7 months post stem cell procedure on thinning the knees. Oh, all right. Thanks, Ron. So Ron commented on how well he's doing with his knee procedures. So that's great. I love hearing your outcomes. Doing great, and hope to see you soon here back in the office. For everyone that tuned in tonight, we really appreciate it. Ashley, thank you for taking the time to introduce yourself to our patient base. And if any of you are even considering any of the stuff we talked about, Ashley does a phenomenal job, both with her consultations as well as her procedures. So please, if it's something you would like us to take a look at, give us a call, 248-216-1008. We'd love to evaluate, see if your condition is something we think we can help.
Yeah, and we'll also be doing some giveaways at our grand opening, which will be announced soon. And this is the grand opening for the new location, not us completely, but
Yep. So thanks, everyone.
thank you.
You have a great night.